All right. Welcome back to East Meets West, an integrative approach to men's health. I'm one of your hosts, Dr. May. I'm a naturopathic physician, board certified in endocrinology with 15 years of clinical experience, and mostly treat endocrine disorders now, mostly men's health, or that's at least what I'm passionate about doing. Mike, introduce yourself, buddy.
My name is Michael Johnson. I'm an acupuncturist, nationally certified, and I've been practicing also for 15 years. And I also love treating a lot of men's health. So I treat a lot of different things. But lately, the passion's really been men's health because it's just not focused on enough. And that's one of the things
Mhm.
our show's about.
That's right. That's why we're here. That's what we're talking about. So today we're going to talk about prostate issues.
Woohoo!
Yeah, I know. Fun subject, right? Well, we always do the really good stuff. Yeah.
Yeah, and it's funny because this almost every I say this every week, but it's true. This is one of the subjects that guys don't like to talk about because when you
Yep.
hit 45 or 50 and they say, "Okay, it's time for your prostate check," every guy just shudders and they're like, "I don't want to do
Yeah.
this."
Yeah. Yeah. Absolutely. Yeah, I know it's a tough conversation, but it's one that has to be done. Like it's so let me throw some numbers out at you because that's what I like to do. Um, men over the so guys who just struggle with BPH, which is benign prostatic hyperplasia, which just means an enlarged prostate. And so men over the age of 60, about 70% of them have BPH. And men over
70%.
yeah,
Wow.
70%. And men
Crazy.
over 70 have 80% of those have BPH. So
Wow.
it's a really high percentage. And I mean, I see guys who start experiencing some symptoms as early as their late 40s. So, this is something that's really going to plague most men in the last half of their life. So, why aren't we talking more about this? It's going to affect, if not you, one out of two to three other guys that you know. And so we should be talking about this and ways to prevent it and treat it because in my experience, I don't know if this has been your experience too, Mike, but the sooner we can get at this, the better results we have, especially like naturally,
Yeah.
as far as herbs and other treatments that don't require medications or surgical procedures. Like those things work, but only up to a certain extent. Like I can tell you, like saw palmetto, which is and we'll dive into this later more specifically, but that's a common one used for enlarged prostate. But once it gets to a certain size, even the research shows that it doesn't help. It doesn't help shrink it, doesn't help reduce symptoms or any of that up to a certain
Wow.
size. So it's like we need to be really preventative minded when we talk about this.
And I feel like that's almost every condition that we deal with is like if you catch it early, it's a lot
Mhm.
easier to deal with. I mean, cancer, anything. And the
Yeah.
later you move, the harder
Mhm.
it is to deal with naturally.
Yeah. Yeah,
So,
totally. And this is no exception.
yeah,
Um,
absolutely. And you know, you're talking about people not talking about it. I see it all the time. I'll see guys who have obvious prostate issues and I tell them to go get it checked because they're showing all the symptoms. And
mhm.
then like they've never been diagnosed with anything because it's like, well, I don't feel comfortable with the test. I really don't want to get like looked at. And
Mhm.
they know like this is an issue. It's just they don't want to deal with this issue.
Yep. Yeah. And you can keep your head in the sand for so long. It's just like I don't know. For me, I'm finding as I get older, I want to just know. I
Yeah.
just need that information, and you need good information to make good decisions, right? So, we're going to kind of walk through what is some of that information. Like, what can you gain from a good PSA? When should you start, doing testing PSA? When should you start getting the digital rectal exams and other stuff like that? And so, yeah, we'll walk through some of that today. But before we do that, let's talk about what the prostate is.
Oh, that's a good
Um,
idea.
yeah, this is that part in itself can be a little confusing about well, what's the job of it? What does it do? Basically, it's this gland that sits between your bladder and your penis. And basically, there's a little tube, your urethra, that drains your bladder and goes right through the middle of the prostate and out. The problem with there is if your prostate enlarges, right, it's going to compress the urethra that runs right through the middle, and that's why men with prostate issues have problems urinating and
Mm.
all sorts of varying ideas or issues urinating. So it's about the size of a walnut, and like I said, it surrounds the urethra. It sits under the bladder. Um, Generally, we see kind of two different issues related to the prostate. We have what are called storage symptoms and voiding symptoms. The storage symptoms are more related to your bladder, and so that's where you're going to get like urinary urgency, like that need to like go. You got to go right now.
Mm.
Increased frequency of urination, sometimes some incontinence, and what's called nocturia, which is getting up at nighttime to urinate. And then you've got your voiding symptoms, which have to do with like your ability to actually empty your bladder. And that's where
Mm.
you see the weak strain or the weak stream. You've got something called intermittency too, which is that sort of starting and stopping of your urine flow. And so basically, most of these symptoms are going to kind of fall in one of those two categories.
Yeah, and that's what I'll see most typically is
Mhm.
somebody's like, I can't sleep through the night. I'm waking up 4 times. I'm waking up 5 times, and then almost nothing's coming out, or
Mhm.
not much is coming out, or they'll think they're done, and then they zip up and they weren't done. That happens a lot too.
Yep. Yep. Absolutely. Yeah, and so we'll kind of go through a few little tricks, that you can do if you're starting to experience some of this. But basically, that's kind of what the prostate does. There is also like the seminal vesicles that produce some seminal fluid that's part of ejaculation. Like so, some of the product of ejaculation is not all coming from the testicles. Some of it actually comes from that gland, like within the prostate as well, and that fluid sort of combines with the ejaculate as well. So yeah, that's kind of the gist of what the prostate is.
And I'm glad you went over that because a lot of people just don't understand. They don't want to pay attention to it. And, like we said, earlier is better. And not to scare all the listeners, but if you do have prostate cancer someday, catching it early on with an exam or, starting out with a PSA or whatever is much better than catching it way, way later.
Yeah. Yeah, it's so prostate cancer, it's crazy, like, there's some kinda crazy statistic, and I should have looked this up beforehand, but, in that, if you live to the age of 80, it's like your risk of prostate cancer is, like, crazy, crazy high. But the problem is, like, most of those men are going to die with prostate cancer, not from prostate cancer. That's
Mhm.
kinda what you want, like, the benefit of the prostate being this sort of encapsulated organ is that a lot of these prostate cancers don't, get outside of the prostate. So they just stay within the prostate and they may enlarge the prostate, but other than that, they're not causing any other issues. And so if like I think one of these studies did actually biopsies of men who, were deceased and looked at like prostate and looked at the incidence of cancers, and it was really high in these men who died from something else, cardiovascular disease, whatever. But many of them died with prostate cancer, and obviously that's kind of what we want, right? We want to die with it, not from it.
Yeah, absolutely. And from the Chinese medicine point of view, we don't
Mhm.
do the same testing as Western medicine. We don't do like digital rectal exams, anything like that. It's more symptomatic.
Mhm.
Whereas I'll send somebody to, a specialist or their primary care, or I don't know if you do prostate digital rectal exams, but
Yep.
I'll send them to someone else to get that done and the blood work, and then I'll look mainly at the symptoms and treat
Mhm.
those. So.
Yeah. Yeah, I've done hundreds, and I don't know. I lost count along. Not that I was really keeping count, but it's not really something you keep count of. But at this point in time, it's been hundreds. Yeah.
You don't have a
Um,
tally book somewhere with like little notches?
no, no tally book. No, that'd be pretty weird.
That's
But,
hilarious.
it is useful. I get a lot of questions like, "Hey, can we just do a PSA? And is that going to be good enough?" And it is good information, but it's not enough. Sometimes you can have an enlarged prostate and not have an increased PSA for various other reasons. And so it's just always good, to get that digital rectal exam done, periodically, but also get a PSA. A little FYI, and your provider is going to know this, but don't do a digital rectal exam and then get a PSA because it could make it look falsely elevated because of
Oh,
the digital rectal exam.
I
Just
didn't know that.
FYI. Yeah. I've seen that happen in kind of rare cases where I don't know, the just provider just wasn't thinking or whatever, and we just redid the PSA and it came back normal. So
So I had a question about that actually. So we haven't talked about this a lot on the show, but I do want to start bringing it up. Like, what are the normal numbers if you have these off the top of your head? I don't know for PSA,
yeah.
and are they different from what say a an MD would say is normal for a PSA? Because we haven't mentioned this a lot, but some of
Mhm.
the ways that we look at blood work are going to be a little bit different than the ways
Mhm.
that maybe a standard Western medical doctor would look at it. So.
Yeah. No, that's a good point, Mike. Um, as far as numbers go, I don't know if my sort of values differ much from sort of conventional docs. You want to see a PSA under 4. Um, I ideally want to see it closer to 1 or below, but really it's not so much about the number, it's about the change in the number over time. So it's what we call the doubling time. So how long does it take for that number to double? If that number doubles in 6 months, well, you're in trouble. That's probably an aggressive or active cancer. If it takes 6 years, 10 years to double, then that's not as bad. So that's why monitoring is so useful. Even if it's just like once a year or once every other year, like just seeing what the change of that number is more valuable than just the number itself. So yeah, that's kind of what I base that on. I also look at if the prostate or the PSA total starts going up, you want to get like some more testing. You want to look at the percentage of free, PSA there, and that kind of gives you a little bit extra information to determine like what the next step needs to be.
That's a good point. And I had a question for you that
Mm.
I've always wondered and I've never asked is what exactly are you feeling for in a digital rectal exam? Like what's the point of it other
Yeah.
than making
Mm.
someone uncomfortable?
Yeah. Yeah. Well, so if you look at the anatomy, the prostate, the way it's positioned, it's positioned right up against the colon. And so that's why we do a digital rectal exam. So you can feel any enlargement if there is enlargement there. And if it's sort of hard and nodular, which is not a good sign, or if it's more kind of squishy, spongy, which is kind of more normal. So, one, you don't want to feel an enlargement. And two, like what type of enlargement are you feeling? Gives you feedback. But yeah, that's
Oh,
basically what you're looking for.
that's really good to know.
Mhm.
So somebody comes in, they'll give me a symptom list. You'll maybe do a digital rectal exam and a PSA. If you notice enlargement, if you notice an elevated PSA, like what are your next steps usually?
Yeah. So depending on how much or what the level of PSA is, I may refer them immediately to a urologist just to get more of a workup. And more information is generally good information. And also depending on symptoms. So if they have a ton of symptoms and they have a PSA, it's like 4.5 or something, more than that, then I'm referring out. Like we need more information. I'm not going to sit and play around with that because, I early on in my career, I did probably I was a lot more conservative, and I don't think it was the right move. So that's what I do now. Now, if they have urinary like frequency and some urgency, and symptoms aren't too bad, and their PSA might be 1 or 2 or 3 or something like that, we may just like kind of sit on that for a little bit and just start doing some conservative care. So there are a
Nice.
lot of things that can irritate the bladder and the prostate. And so those may be food related and maybe environmental related. I had one guy who was drinking, 2 pots of coffee. It's like every day. And it's like, yeah, dude, like you're irritating your urinary tract in general. Like let's drop that. And a lot of his symptoms went away. So avoiding those irritants like caffeine and alcohol and some other, there's a pretty long list of them. Sometimes too, if you already have a little bit of enlargement and you get a cold or something, you start taking some antihistamines or decongestants, those can actually make it worse. So like just being aware that there are some even over the counter medication out there that can make your prostate issues worse. Um, and
Mm.
then, this like little things like what we call sort of the double void, which is where you like, you start to pee and then you can't quite get it out. And so one of the things you could do is you can squat down like into a deep squat and
Yep.
then stand back up. And sometimes that is enough to kind of get the rest of that stuff out, or changing the position that you pee in. Sometimes if you get one of those kind of potty squatties, which is, helps you like, basically it helps you like poop without like developing hemorrhoids because of the way it positions like your pelvis, right? It can actually help with voiding urine as well. So sometimes just those positional changes can do a lot. And then obviously like some of the herbs and things like that, saw palmetto, nettles, see what else. Pumpkin seeds. Like those are kind of my top three that I go with.
Nice.
Yeah.
That's really good. That's good to know too. I recommend the same thing for my patients. Is like sometimes standing up can be a lot more difficult, and sitting or squatting is going to be a lot easier for voiding.
Yeah.
While we start to work on things, with acupuncture, with supplements, with herbs.
Mhm.
From the acupuncture side, if you don't mind me talking about it a little bit.
Yeah.
So,
Yeah.
so in the front and the back, before you have all the other channels develop, you have all these acupuncture channels down your arms, legs, all over the place. But the first ones that develop in the womb are actually the conception and governing vessels. So conception, if people watching, you'll see, people listening, I'll tell you, right down the middle in the front. And that's called the Sea of Yin, because they look
Mm.
at everything almost from a water perspective. So you have sea, and then you have like river point, you have, and it gets smaller as it goes to your limbs, which makes sense, right? When you think about movement of fluids in your body, you're going to have a lot less volume, in the small bits than you are in the big ones. And so in the front's the Sea of Yin. The really important one here is in the back along the spine, which is the Sea of Yang, which is the governing vessel. And so there's some really good points all up and down that for a lot of different organ problems, including the prostate. And so you can actually work on these points very specific to these different areas and organs and be able to help them.
Huh. Really?
Yeah.
That's
So
interesting. Yeah.
so for the prostate, one of my favorite points is one that guys do not like until they get it treated, and then it helps and they like it. And it's actually do one. It's right under the tailbone. So
Oof.
between the tailbone and the anus, it goes about inch and a half in. Doesn't
Oof.
hurt usually, but it's just uncomfortable. You can do it
Yeah.
sideline, so people can be on their side, which is a lot more comfortable than face down for it, because you can drape with your
Yeah.
blankets, so you don't feel so exposed.
Uh-huh.
But I've seen people with a lot of symptoms, urinary symptoms, that have noticed significant difference just with that one point, just right under the tailbone. And it makes sense if you think about anatomically where you're at. And you can also treat front points as well, but it's a lot easier from the back. And it helps with, so one of the things that acupuncture can be good for is inflammation. And so if you have inflamed enlargement, then you can help it quite a bit. So.
Yeah. Yeah. I mean, I think that's kind of the name of the game is that enlargement aspect, and what's causing that, whether it's inflammation, like a prostatitis type of thing, or if it's hormonally driven, like if you're converting your testosterone into dihydrotestosterone, which is like 10 times stronger than testosterone, and it's very stimulating to the prostate cells. So it makes you grow more prostate cells in the area, and then that creates enlargement. And so that's where a lot of these medications and supplements are geared towards. They're 5-alpha reductase inhibitors, which is basically the enzyme that converts testosterone into dihydrotestosterone. So you're taking these things to at least reduce or inhibit that enzyme, thus decreasing the level of testosterone, which decreases that stimulation to the prostate. So this is where like your finasterides and dutasteride medications come in, or the saw palmetto and nettles and pumpkin seeds. Those are all in that sort of category of 5-alpha reductase inhibitors.
Interesting. I
Yeah.
love learning things from you. It's so awesome.
Yeah, likewise. I think I mean we literally say this every week, and that how just the Chinese medicine has been around for so long and such great observers and like have figured this thing out like so much longer ago and we're just kind of validating that with modern research now.
And from our point of view, diagnostics always completely different. So
Yeah.
from our point of view, it's not going to be like, oh, you have an enlarged prostate,
Mhm.
because they didn't really have those words for it. What they're going to say is you have a kidney Qi deficiency. Now, this isn't always. This is one of the things.
Yeah.
Kidney again.
A kidney again. I would have
Uh,
guessed that. Yeah.
but yeah, kidney Qi deficiency, and it makes sense if you think about it, because the whole idea of kidney Qi is it's like the root reproductive Qi in the lower part of your body, and you want it constantly flowing and moving.
Mhm.
And if it's not constantly flowing and moving, then you're going to have problems. You're going to get blockages. Things are going to get bigger. You're going to
Mhm.
get fluid collection there. So that's one thing we look at. And one of the ancient symptoms for kidney Qi deficiency is, urinary issues, problems with good urine flow, waking a lot at night to urinate. So a lot of the symptoms we're talking about
Mhm.
are the same as what they were calling kidney Qi deficiency, because that's the words they had for it.
Hmm.
Another diagnosis is damp heat in the lower jiao, which sounds really weird, but all you're thinking here is swollen.
Hmm.
So damp heat would be like if you had an infection. If
Mhm.
you have some sort of infection or inflammation that causes swelling, then basically it gets stuck. All that fluid just gets stuck there
Mhm.
and it doesn't move. And so it gets bigger.
Mhm.
So, when they say damp heat in the lower jaw, that's all they're talking about. Another diagnosis we look at is if you have a liver Qi issue. We've talked about liver Qi deficiency before with anxiety and stress. And
Mhm.
that stress and anxiety can actually affect the prostate, which it can when you look at, you know,
Mhm.
prostate issues. Stress and anxiety do not help. So it makes
Yeah,
sense.
absolutely. Yeah. Yeah. That's interesting. You kind of talk about the swelling, dampness kind of thing. That I immediately think of like prostatitis, like caused
Yep.
by some kind
That's
of
it.
infection.
Absolutely. Yep.
Like there are some STDs that can cause prostatitis and other things. Or but yeah, that's kind of what I think. And it made me think. A couple years ago, I did this ozone training, and it was mostly like all over, like mostly joints, like musculoskeletal type stuff. But there was a one procedure that they actually demonstrated on a model like in class, and it was the prostate one. And you take this like 3-inch needle and inject it into the prostate, multiple
Oh,
locations, and inject ozone into the area. And it's supposed to be particularly good for prostatitis, but also they're starting to use it with some types of prostate cancer, and I guess they're seeing some good results. But I'm just like, man, I can't think of a guy that would want to sign up for that.
yeah, that's a tough sell. You have to be a really good salesperson
Yeah.
to be like, show them the needle and be like, hey,
Yeah. Yeah.
this will help.
Oh, it was cringe worthy to kind of watch. Oof. Um,
I love to hear you talk about Chinese medicine because you nailed it. Most of the time, damp heat is going to be some sort of active infection,
mhm,
or inflammation. And when you hear heat, you're usually thinking some kind of virus, bacteria, something that's causing the swelling. So,
yeah. 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 Absolutely. All right. So if we kind of go through, like, let's say, like, since BPH is kind of the main thing most guys are going to be dealing with, if we kind of walk through those conservative management treatments, like, limiting your fluid at least 2 hours before bedtime, avoiding those irritants like coffee and alcohol, watching any sort of over the counter meds like antihistamines or decongestants, and then doing the positional changes that we kind of talked about. like and the herbal stuff too, saw palmetto, nettles, pumpkin seeds. Let's say you try all that stuff and it's just not working. We need to do something stronger. Well, you've got a few. So the next thing is to like jump to medications, right? And this is where you've got basically like three different categories of medications that you would kind of walk through. One of those are what are called their alpha blockers. This is like the tamsulosins, like Flomax, and basically what that does, it just relaxes the smooth muscle around the prostate, and then obviously if you can relax that, then flow through the urethra can happen more easily. Um, and that's one that's probably like most people have already heard of. Like that's a really popular medication to use. Um, but I'd say like side effects are, they can definitely happen. You can get dizziness. You can also sometimes get what's called retrograde ejaculation, which is basically like where the ejaculant actually backs up into the bladder.
That's a
Um,
problem.
that's a problem. Yeah, that's not good. But for the most part, I'd say like tamsulosin works really well, especially earlier on. Um, the other one classification is the phosphodiesterase 5 inhibitors, which these are your kind of tadalafil, so Cialis. This one, I think this is one of the ones I love most to kind of start with first because it works in so many good ways. Just a small dose of like 5 milligrams a day has been shown to like improve urinary symptoms. And
Wow.
yeah. And so this is the one that, this is the medication we use to have better erections, right? But it can actually improve urinary symptoms at the same time at a small dose. So this is kind of a no-brainer. Like, all right, if you can help a guy get better erections and pee better, like, I mean, it's a win-win, right? So
That's a lot better than 3-inch needle.
yeah, right. Yeah. Like, so this is a great one to just kind of start with, especially if symptoms aren't responding to more of the conservative management. So that's one of the first ones I'll jump to. Um,
Nice.
and then the next one is your alpha reductase inhibitors. So that's the finasterides and tudasterides, like we're kind of talking about earlier. This is that shrinks the prostate, and this has to do with the hormonal influence of that dihydrotestosterone on the prostate. Now the problems I see with this, and this is kind of my last kind of effort, if you will, because I see more side effects, especially with finasteride. It does a really good job of shrinking the prostate, but it will take time. It's going to take you like 6 to 12 months before you really start to see the full benefits. And in that time period, I tend to see quite a bit of sexual side effects, like decreased libido. Depression is
Yeah.
a huge one. I've had 2 guys just in the last few years that actually got suicidal on finasteride, and it wasn't a really high dose. Like a dose to decrease, like to actually treat BPH, could be somewhere in the realm of like 2 to 5 milligrams, like 3 to 4 times a day. So it's quite a bit. And I've seen depression and these suicidal ideologies like pop up with as little as 1 to 2 milligrams just once a day. So, if you get put on that, just kind of be aware of that. It is one of the few medications that's actually been shown to shrink the prostate by as much as like 50%.
Wow.
No, it is pretty effective, but it does come at somewhat of a cost. So you just got to be aware of that and just remember it's going to take some time. It's not going to happen like overnight. It's going to take months for you to start to see that benefit. But those are kind of the three medication classifications that we use. And then beyond that, you've got surgical interventions. And that's mostly like, if you've got like frequent urinary tract infections and you're like peeing blood, and you've got like recurring bladder stones and stuff like that, like that's more serious. If it starts to kind of creep up into your kidneys, that's even more serious because, we don't want kidney damage. Kidney damage is really, really significant and can majorly impact your life. So again, you're always kind of weighing risk versus benefits, right?
Yeah.
And it's got to be pretty bad before you think surgery. But again, that's where you and your urologist have to kind of make that decision when the best time to have that intervention if you need that. But again, back to like what we started with, like it's all about prevention, right? Like
Yeah.
getting all of this like as soon as possible. So guys, don't play around with this and just be like,
Yep.
oh, this is gonna like go away on its own, and put your head in the sand, because the longer you wait, it's the more likely you're gonna need a higher level intervention to manage it. So
Yeah. And I have a story about that actually. So one of my patients had come in and she was so mad at her husband. And I guess what had happened is he'd been ignoring these symptoms forever and didn't tell her anything. He started peeing blood. He didn't tell her anything.
oh,
Finally, like she saw it one day because it didn't flush all the way. It's like, what's going on? He ended up having prostate cancer. He was okay. He got surgery, but he waited that long where he didn't even want to talk about the fact that he was peeing blood. He's like, oh, it'll work itself out. It'll
mhm,
work itself out. And then
yeah,
like, if he would have caught it earlier on, it would have been a lot easier than having to go have
mhm,
surgery.
yeah,
And I'm also glad you mentioned finasteride because a lot of people use that for receding hairline,
mhm.
and they may not realize that there can be side effects from it. So,
Yeah, yeah, that's one I rarely, like, earlier on, I used it more orally, especially for, like, hair loss, alopecia and stuff like that, but, yeah, I don't know, I've seen just a pretty significant amount of side effects from it, so I rarely ever use it now, um, just because I think, again, if we catch it early enough, we've got a lot of good tools, like,
yeah,
other things work. I love combining, like, what I do with acupuncture,
yeah,
because it works so great. Such a great combo, especially for, like, prostate issues, but, with a ton of other stuff as well, but in
mhm.
this regards, it just works great.
Yeah. I mean, in the acupuncture, I'm not only doing local points, I'm also doing points for the kidney stuff. I'm also doing points for stress and anxiety. There's points on the hands and feet you use for basically any guy who's dealing with stress and anxiety are going to get. It's called the
Mhm,
four gates: large intestine 4, which is this really tender point in the triangle where your first finger and thumb meet. It's
mm,
super tender if you squeeze on both sides for just about everybody.
yeah,
So it's that point combined with the one between your big toe and your second toe. And it's up
oh,
right where the bones meet. And it's almost always tender on people too. So I'll use that combination. I'll do some points on the front for bladder and for kidney. And then I'll do the points on the back I was talking about. As
mhm,
well as some Chinese herbs can be really helpful. I'm usually working with a doctor such as yourself because, saw palmetto is not a Chinese herb, but I've seen it help a lot. There's
mhm,
also um, rogué, which is like the bark part of the cinnamon, and it's
mm,
really helpful and it's tasty, and
mhm,
it's really good for these prostate and urinary issues. There's also Chinese raspberry, which can be really good for a lot of people, and these tend to really have a really low side effect profile, which is great.
mm. Nice, nice. Alright, cool. That's really interesting that those 2 points are kinda, like, synonymous with like, points on the hand and the foot, like, they're in the kinda same location.
Yeah, yeah, and there's probably something to that. There's a lot of that in Chinese medicine where points mirror each other. It's
Mhm,
actually the same with the one under the tailbone. There's a corresponding point between the anus and genitals that I never use in practice. Almost, actually, I've never once used it in practice. Not because it's not effective, but because to get somebody to agree to that point is problematic.
yeah,
Because it's a really sensitive point. You can't really drape it with blankets, like you're just exposed. But those 2 points coincide. So one of them is the first point, which are the first points are usually the strongest or among the strongest. So the
mhm,
one under the tailbone I was talking about is the first point on the governing vessel, which governs like yang. And then the first point on the front, on the perineum there is the first point on the conception vessel. And so they actually work together. So those 2 points combined are terrific. If somebody will submit to that, it can be very, very good.
yeah, yeah, submit to that. I know
And
it's a
we're
hard sell.
And talking about mirroring, something else you can do with Chinese medicine that's cool. I don't know a Western explanation for it is you'll do top and bottom. So if you're doing these points down there to help with the prostate, you'll actually do points on the top of the head to kind of bring
Really?
things up too, because you don't want everything to settle down in the bottom. You want it to move. And
Yeah,
so you'll do points in the front on top of the head, which will help move everything up. And so, almost everything has correspondence in
Mm,
Chinese medicine. So if you're doing something below, you should do something above. If you're doing something on the left, you should do something on the right. It should correspond and balance. It's all about
mm,
balancing things out. So it's not just, I'm going to do this one point and this is going to help all your issues. It's like, okay, we can do this point, but you need to do these other things to make sure it balances and you don't just have this one-sided treatment that's not treating you as well as it could.
mm. Yeah. Yeah, that's great. Nice.
Yeah, and I won't ever run electro on those points. You probably could. Electro is when you hook up electricity to the needles between 2 points.
Hmm.
You have to be careful when you're doing it around the spine or in the middle of the body in general. So most of the time when you have electricity, you're going to use it more on extremities between certain points than you are over organs.
Hmm.
You don't ever, most people won't do electro across the spine at all or across the stomach at all, just because is it likely to cause a problem? No, it probably won't. But
Hmm.
you have so many organs, you have nerves, you have the spinal cord further up that it's just too much of a risk to take. So you just do straight needling. And, I've had people after a treatment or two come back and completely different. The urination's
Yeah.
much better and it's just reducing that inflammation. It's helping free flow and people just feel a lot better.
Yeah. Nice. Yeah, when I think like congestion, I mean, acupuncture automatically comes to my mind of like getting things moving like they're supposed to move. So
Yeah.
if I've got like, something like that, like a prostatitis or enlarged prostate, or, even like a joint or something that's just kind of red and hot and just kind of puffy, and I just can't get the swelling go down. Like, I don't know, acupuncture just seems to me like at the top of the list of things to sort of drain that area, if you will, and get things kind of moving because there's so much sort of congestion in the area.
Yeah. And before you just go to acupuncture, it's very effective, but I tend to be more on the aggressive side. You sound like the same. Like earlier in your career, same for me. It's like
Mhm,
I can conquer the world. I'm going to figure this out. And
mhm,
I can help people, but if I think you have a prostate issue, I'm also going to be referring you to a doctor, like,
mhm. Yeah.
period, just because I want to make sure there's not something else going on. Because otherwise, we're going to treat you quite a few times and you're going to notice some difference, maybe
Mhm.
just enough that you don't get checked out for something more serious. And
Yeah.
that's my big worry is like helping someone to the point that they feel like they don't need to get checked for something that could be worse. And
Mhm.
so, yes, I will help you, but also, yes, I'm going to hopefully work with your doctor to make sure that you're getting treatment care from a lot of different perspectives. Because from my view, the more perspectives you have, the better. Because you got multiple sets of eyes on a problem, you got multiple different ideologies on a problem, and you're going to end up with a lot better care than just one person that can make mistakes. I mean, I've
Mhm.
overlooked things before. You've probably overlooked things before. It happens
Mhm.
because we're human.
Absolutely, man. It's well stated, Mike. Like, I'm with you. Like, it's funny, like when you're like early in your career and like, I don't need anybody else. I can figure this out. I can fix this person. And it's just ignorance, right? And it's just like with experience, you realize like if I'm really going to serve this person as best as possible, I'm not the only person they need to see. They need other perspectives, they need other therapies. And that's just some wisdom that comes with that experience, right?
Yep.
And understanding like kind of where your place is in that sort of treatment spectrum there. And yeah, I totally agree. Like that was well said, buddy.
Thanks. And I would also say choose your practitioners carefully because every practitioner is different. This is MDs, this is NDs, this is acupuncture, this is everybody. They're
Yeah.
all different.
Yep.
And if you ever, I'm not telling you to not see your practitioner because that's a decision you need to make. But if you run into people who are like, you don't need to see anything else, just,
Hmm.
do this, you're fine. And you get the feeling you're not fine. If you get the
Hmm.
feeling like, something's up, like something's wrong, like don't ignore it because people do make mistakes. And if your doctor's somebody that doesn't like to work with other doctors, then sometimes they can miss things. And I've seen this so many times in my career. And so, if you're having these symptoms and, your PSA looks, on the high side of normal and you're like, well, I was told I'm fine, I'm just going to ignore it. Like I would say, still seek out other help. I mean, listen to those intuitions because sometimes you'll know on a deep level before anything shows up that like
Mhm.
something's off, something's wrong.
Yeah. Yeah. I totally agree. Well said, man. Well, before we get done here, let's talk a little bit about prostate cancer because that's another big one there. So just kind of throwing some rates of incidence and stuff like that out. There's generally about 240,000 new cases of prostate cancer in the U.S. each year. It's going to affect about 112 men per 100,000, and that's
Wow.
all men of all ages. Now, if you are, I'd say, I think it's 6 out of 10 cases of prostate cancer are diagnosed in men above the age of 65. And we do tend to see a higher risk in more African American men. There are some other things that increase your risk. If you have a father or a brother who's been diagnosed with prostate cancer before the age of 60, you may have an increased risk, as well as a close female relative that's had breast cancer. That
Huh.
may also increase your risk. Yeah, this is an interesting area of research that I've been seeing kind of pop up more and more of this relative risk to breast cancer. Like you can actually look at the BRCA gene mutation in men now to see if they may have a increased risk for prostate cancer. So just being aware of those risk factors that may increase your risk. Obviously, like lifestyle stuff is going to be a big part of that too. Smoking, tobacco use, other environmental exposures, chemicals and toxins and stuff like that. All that stuff's going to affect that. Diet as well. There's some evidence that suggests that a diet high in calcium may increase your risk of prostate cancer. That one I think is still not quite illuminated entirely. And then
Interesting.
vitamin D deficiency too. So we do tend to see that incident go up the further away from the equator you get in general. And we know vitamin D does a ton of stuff, right? It's like, especially living in Alaska, like both of us have. I mean, we see so many issues from vitamin D deficiency, and this can be one of those. And then folate and B12, those are two B vitamins. Low levels have been associated with cancer development. We don't really think it's necessarily a causative factor, but there is some correlation there that's been seen.
Yeah, it's good that you mentioned that too, because yeah, again, prevention. We talk about every week. You'll hear the same vitamins come up. You'll hear the
Yeah.
same things come up where it's like so many conditions we talk about is like, oh, vitamin D deficiency will
Yep.
affect this, B12 deficiency. So,
Yeah.
think about it. If you hear all these different conditions that a deficiency is going to cause it, then supplementing is going to be a good thing before it gets to that point. And diet's a huge one. I forgot to mention that from the Chinese medicine perspective, but in general, Chinese medicine's all about a lot of clean eating, not a lot of processed foods. You cook it, you cook it from scratch if you can. And people are going to say, well, I don't have time for that. It's like, I'm a single dad with 3 kids. I get it. It's hard to
Mhm.
have time for it. Cook ahead. When I make rice, I make 3 days worth of rice. I make a massive amount of rice so that I'll have leftovers that I can not warm up in a plastic container because I don't want man boobs. See a previous episode for that. But
Right.
plug. But in general, it's like just these steps of like, okay, I'm not going to cook from a bag today. All right.
Yeah.
I'm just going to, even if it's something simple, it's like rice is really easy to make. My kids can make rice.
Absolutely.
So
Absolutely.
clean
That,
your diet up is going to help.
yeah. The other question I get a lot is, does testosterone, increase your risk for prostate cancer? And especially like testosterone replacement, right? And the answer is no. And this has been
Huh.
actually studied quite a bit. The latest study was actually published just last year in 2023, and it was published in the Journal of the American Medical Association. So JAMA, this is a pretty big one. And it found that men with low testosterone levels who took testosterone didn't have an increased risk of prostate cancer compared to those who took placebo. And these kind of studies have been done multiple times. So the evidence is pretty clear. Now, I'll tell you, there's some nuances to it. If you have really low testosterone, like under 250, and you start testosterone replacement, it's very likely you're going to see your PSA go up. The
Hmm.
reason for that is it's what's called the saturation point model, in that when you flood the body with some extra testosterone, and you're going to get the prostate it's going to sort of, those cells are going to start soaking some of that up, right? And it's going to have a stimulating effect to some extent to the prostate cells. And so you will see your PSA go up a little bit. But once you hit that saturation point, which from what I understand in the evidence is somewhere around 250 blood levels of testosterone, maybe up to 300. But once you exceed that level, your PSA doesn't continue to go up. It stabilizes because you've hit that saturation point. And even if you have prostate cancer, it doesn't rule out the ability to take testosterone. It is something, it's kind of tricky. So depending on the type of cancer and everything, like this is something that you need to talk to with your urologist and oncologist, but it doesn't completely rule out the ability to take testosterone.
Mm.
I'll tell other people, like, especially with TRT, it's really more about the estrogen that you have to worry about than it is about the testosterone. So realize that testosterone, some of that can convert into estrogen. And we do tend to see more issues with prostate cancer in high estrogen states. So I'd say focus more on the estrogen aspect than really the testosterone. Because too, like we actually see a higher incidence of aggressive prostate cancers in men with low testosterone. So don't be afraid of testosterone. Like it needs to be done well and appropriately, but don't completely rule it out. And this is something that's still kind of perpetuated in conventional medicine to some extent, especially at the primary care provider level, where it's like, it's a large ship with a small rudder. So this information takes time to get dissipated and become sort of mainstream, right? And unless you're just staying up on this particular type of research, you don't always get updated for sometimes years, and
Yeah.
that just takes time to make it through all the channels, right?
Yeah, I've seen decades before. I've seen 10, 15 years where it's like people just fall back on what they were taught in school, which is great,
Yeah.
except when it changes. And then it's not as great.
Yeah. Absolutely. Takes a long time to get that to change. I mean, we saw a perfect example with the Women's Health Initiative and hormone replacement in women. That was published in 2001, and that basically put the kibosh on doing HRT in women for the longest. And we're just now starting to get to a point after multiple of other studies that have shown different results. We're just starting to get now to a point where you're starting to see the smallest level of change in sort of conventional mindset as far as OBGYNs and primary care providers and doing hormone replacement in women again.
Yeah. That's good stuff, man. So what's our wrap up here? What do you want to, tell guys when it comes to
Yeah.
prostate?
Well, I feel like it's kind of a broken record here, but it's all about prevention, right? And it's all about early detection, early treatment. Like, guys, just quit. You get your, I want to say get your head out of your ass, but get your head out of the sand here, and just realize that those symptoms are there for a reason. So get them checked out sooner than later.
Yeah,
So you can
same
actually
thing for
do
me.
something about it. Take action.
Yep, same thing for me is just, catch it early, get it checked out, get intervention early on, and you'll be a lot happier for it, and people around you will. And imagine not having to wake up, 4 times a night to pee. It's a nice thing.
Yeah, absolutely. I can tell you too, like from our perspective, I love it when guys come in and they're just starting to experience these symptoms. And it's like, oh, yeah, it's been going on for like 3 to 6 months. I'm like, sweet. Like, we can totally turn this around. But, compared to that guy who's like, yeah, I've been struggling this for like 5 years. I'm like, well, I don't know how much I can help you, but let's see what we can do.
Yep. Same thing from my perspective. It's like you come in early, it takes a lot less treatment. The later you come in, the more intervention it's going to take. So I agree. Broken record, I don't care. Get it checked out.
There you go. All right. That's a great note to kind of end with. So anything else you want to, Mike?
No, I appreciate y'all tuning in and let me talk a little bit about the Chinese medicine perspective. And Dr. May, as always, it's awesome to see you.
Yeah, likewise, buddy. All right, guys, thanks for listening and tune in for next time. Until then, stay healthy.